This training film from Simple Measures will show you how to use ROC to drink. This is a simple assessment tool that will help everyone identify a person's risk of dehydration based on the level of support that they need from a carer to help them to drink. It is very important that every carer understands how it works. However, it will be your manager who will decide who is responsible for completing the documentation. Later in the film, you will also be introduced to the ROC assessment grid, which assesses other areas of care that are needed to support drinking and eating. The word ROC stands for reliance on a carer. This describes if a person is dependent on a carer. ROC uses simple colour coding, green, amber and red, to highlight a low, medium or high level of support, which also matches the risk of dehydration. To do this, it assesses how much support is needed for swallow, assistance and encouragement. Whichever of these has the highest colour rating will automatically identify the highest level of support needed to drink, as well as a person's risk of dehydration. The ROC to drink guideline looks like this. Remember, you can press pause or rewind at any time to take a closer look, or alternatively, at the end of this video, you can view a copy of the guideline via our website. The easiest way to understand the guideline is that the description in the green sections means that a person is independent and does not need any specific support from a carer, and as such has a low risk of dehydration. The amber sections describes a person as needing some support and therefore has a medium risk of dehydration, and in the red section as needing full one-to-one support from a carer and as such has a high risk of dehydration. The amber section for swallow describes a person needing a prescribed thickener, and the red section needing one-to-one support with swallow, for example if they have a high choking risk. However, it's important to note that a carer must always refer to the person's individual care plan for full details about how to manage swallow problems. The section for assistance states that a person needs a low level of care only if they can independently and safely pick up their own cup, which has been left within arm's reach. Amber highlights the need for some assistance, and red describes that they need full one-to-one assistance to hold their drink. The section for encouragement describes how much a person normally has to drink. In simple terms, these are drinks which are usually offered throughout the day. For example, early morning breakfast, mid-morning, lunch, mid-afternoon, supper and before bed. We know that if a person can independently drink all of these, it will provide about 1.5 litres a day, which in general terms is a good amount to help keep the body hydrated. This explains why they have a low risk of dehydration compared to those people who only drink about half or less of routine drinks and need regular encouragement or reminder to try and have some more, or those who decline after a few sips and need frequent and gentle encouragement little and often to try and increase their daily fluid intake. Simple Measures recommends that ROC to drink is done on admission and thereafter weekly unless there is a specific change to their level of need. For example, if a person becomes unexpectedly unwell, suffers an injury, or becomes increasingly frail. However, if a person's condition is very stable, you may decide to review this monthly. To complete the assessment, refer to the guideline and select the description that best matches the person's needs for swallow, assistance and encouragement. In this example, the grid has crosses in all the green boxes. This means the person does not have a swallow problem, can independently and safely pick up their cup, and drinks 3/4 or more of most daily routine drinks without any need for encouragement. Therefore, their highest colour is green, and as such, there is a green in the traffic light box which indicates they need a low level of support to drink and have a low risk of dehydration and could be given a green drinks coaster. This example shows that the person now needs some regular encouragement to try and drink, as they are only drinking about half of their daily drinks. Because the highest colour is now amber, it means they have a medium risk of dehydration and the colour of their drinks coaster would be changed to amber. This next example shows that the person now needs some support with swallow and needs full one-to-one support with assistance and encouragement. Because of this, the highest colour is now red, and it indicates that they now need a high level of support to drink and as such have a high risk of dehydration, and the colour of the drinks coaster could be changed to red. On the reverse of the ROC to Drink guideline, there is a care plan summary which outlines the level of care any person should expect to receive, depending on their risk assessment. Even if a person has been assessed as green, a carer will still need to ensure they provide the basic level of support, such as giving somebody help to sit up, ensuring that their drink is left on the right side, and popping back after a little while to check that they've got everything that they need. The care plan identifies that if a person needs amber assistance, it's about encouraging maximum independence to help the person to lift and hold the drink themselves. In the encouragement section, we can see here that a carer should return approximately 2 to 4 times and offer gentle encouragement or reminder to try and have some more to drink, but should not persist in encouraging if the person's made it clear they don't wish to have any more. And also throughout the day, they need to prompt regular extra sips of fluids to help support their daily routine drinks. This section on red highlights the importance of the carer being given protected time to provide full one-to-one assistance to help somebody to have their drink. In the encouragement section, it highlights the importance of offering fluids little and often, at least 1 to 2 hourly or more frequently if appropriate, but ensuring at all times that it's in the best interest of the individual. We know that helping a person to drink to maintain an optimum fluid intake will also require a holistic approach, looking at a person's difficulties with communication, support from a carer to help them to sit up or transfer from bed to chair, support with mouth care, continence and with eating. To do this, the Simple Measures has developed a ROC assessment grid which highlights all these factors. And it's at the bottom of this chart where you will be recording the person's level of support with ROC to Drink and their risk of dehydration. Key points from the Care Quality Commission from 2014 highlight that people must have enough to drink and to eat to reduce the risks of becoming dehydrated or malnourished. They must receive the correct level of support and encouragement to drink and eat. Intake should be monitored and recorded to prevent unnecessary or avoidable dehydration. Regularly review nutrition and hydration needs, and changes should be responded to in good time, and action must be taken to address any concerns. In response to this, the CQC can now prosecute without first serving a warning notice if there is a failure to meet this regulation. In response to the Care Quality Commission, the NMC, who is responsible for registered nurses, highlights that all nurses have a duty of care to provide help to those who are not able to feed themselves or drink fluids unaided. In 2015, NICE Guidelines for Care of Dying Adults highlights the importance of supporting the dying person to drink if they wish to and are able to, and help should be given with frequent sips of fluids, care of the mouth and lips, and help with cleaning teeth or dentures. Sadly, we know that when a person does not get the correct level of support, it is a simple fact that they will become increasingly dehydrated. In practical terms, what this means is that they will have a much greater chance of developing a urine infection, becoming constipated, feeling dizzy, which can cause them to fall, or even becoming unexpectedly agitated and confused, or increasingly sleepy and lethargic. And because of this, they need regular daily support and, most importantly, time from a carer to either help hold their cup or simply to gently try and encourage them to drink more. The Simple Measures system provides a ROC assessment grid, seen here. Your senior manager will decide who is responsible for filling out the ROC assessment grid. For example, it may be delegated to a senior carer or a nurse. However, it is very important that all care staff understand the different sections of the grid and are familiar with the ROC guidelines. The grid has been designed to make it quick and easy for everyone to see the highest areas of care by putting a cross in either the red, amber or green box for each ROC assessment. To do this, it uses a range of newly developed risk assessment tools called ROC. ROC stands for Reliance on a Carer. The ROC assessment tools have been specifically developed to help everyone understand the vital role of the carer and highlight the different levels of support that a person should expect to receive to help them to drink and eat, so that they can remain as well hydrated and nourished as possible. Each individual ROC tool uses colour coding, red, amber and green, to flag up the level of support that a person may need. For example, green means a person is independent or doesn't need any specific support from a carer. Amber means they need some support, and red means either full one-to-one support or in some cases 2 carers. It's important to remember that when assessing how much support a person needs to drink and eat, you must also assess if they need any additional support with communication, such as hearing, vision, speech, and cognition, or with positioning linked to mobility and manual handling, and also with routine mouth care. To complete the ROC grid, you will first need to refer to the ROC guidelines. For example, this completed ROC grid shows us the different levels of support that this particular person needs for care. The red ROC rating for hearing indicates that the person is very deaf, even with the help of hearing aids. We can therefore see at a glance that this person needs a high level of support from their carer. An amber rating for vision would indicate that the person is partially sighted or dependent on their glasses. A cross in the green box indicates that this person has no problems with their speech, whereas the cross in the amber box for recognition of drinks and meals says that they sometimes appear not to recognise or understand what their drink or meal is. Here we can see this person requires a high level of support, and therefore 2 carers are needed to help them to sit up in bed to safely and comfortably drink or eat, but only need 1 carer to help them transfer from bed to chair. The ROC tool for mouth care describes the person as being independent and scoring green only if they are able to safely walk to the sink unaided and brush their own teeth without any need for assistance or encouragement. Where a person can walk safely to the toilet unaided, but once there needs some support with personal hygiene, they would score amber. The 2 final ROC scores focus specifically on eating and drinking. It is important to note that both of these are subdivided into 3 separate parts. This is so you can separately assess the level of care that is needed for swallow, assistance, and encouragement. For example, with eating, if someone's usual care plan states that they need an adapted diet because of a swallow or chewing problem, you would put a cross in the amber box. If the same person then needed full one-to-one assistance to eat, you would put a cross in the red box. But if, however, once they have been given the correct level of assistance, they usually then eat 3/4 or more of most of their meals, you would put a cross in the green. When you have done these 3 separate assessments, you can see which one has the highest score. In this case, it's a red. This will automatically flag up the person's highest ROC rating for eating. You could then use this colour as a visual prompt, such as providing a red tray, a red placemat, to help remind everyone about the level of care that's needed. The ROC to drink section follows exactly the same pattern. For example, you can see here this gentleman has been given a green drinks coaster. Using this visual prompt, it automatically tells you that his highest ROC rating was green. And as such, we know he has no swallow problems, can safely and independently pick up his cup, and that he usually drinks about 3/4 or more of all his daily drinks, without any need for encouragement or reminder. This also indicates that his potential risk of becoming dehydrated is low, simply because he is a good drinker. When a person scores green for swallow and green for assistance, but an amber for encouragement, it flags up the importance of providing regular prompting and encouragement to help them maintain a good fluid intake. Without this level of support, it becomes clear how easy it is for somebody to become increasingly dehydrated. If a person can only drink a few sips at a time and then they start to decline, they will need encouragement little and often. This can be as frequently as every half an hour, depending on how well they respond to you. In this example, you can see this lady is safely and independently picking up her cup, and she has no swallow problems. But when you look closer, you can see that she has got an amber coaster underneath her water glass. What this tells us is that she needs some level of support from the carer. And when we look at her ROC overview grid, we can see that the support is needed with encouragement. The ROC to eat and ROC to drink guidelines both have a care plan summary on the reverse of the guideline. This identifies exactly how much support a person should expect to receive, both for assistance and encouragement. As you can see here, it is broken down into different stages for green, amber and red. For support with swallow, you must always refer to the individual care plan provided by your care provider. The back of the supporting guideline raises awareness about the importance of providing holistic care for drinking and eating. A person's risk of dehydration can change very quickly due to unexpected illness, injury or frailty, and can go from a low risk to a medium to a high in a matter of hours or days. We recommend the ROC assessment grid is reviewed weekly or if a person's needs unexpectedly change. However, if a person's condition is considered very stable, you may decide to review it monthly. At the top of the chart you can record a frailty score. There is also a section for risk of malnutrition. By including this, it reinforces the importance of providing the correct level of support for eating, as well as prescribed nutritional supplements. In summary, the key points from ROC to Drink highlight that a person with a low risk needs their drink left in arm's reach, and that carers should routinely check that the person is still drinking well. Medium support means a carer must regularly go back to the person about 2 to 4 times each time a drink is given, and offer gentle encouragement as needed, but must not persist if they make it clear they do not want any more. A high level of support requires protected time to provide one-to-one assistance or to offer sips little and often. The use of visual prompts such as red, amber or green coasters will help everyone see at a glance the level of care needed to drink. However, it's important to note that the ROC assessment tool does not replace a carer's judgment about other signs and symptoms of dehydration. For more information about these, please go to our website. You have now completed the training film. Please now complete the multiple choice tests. Having successfully done this, you will receive a certificate. For more information about Simple Measures and the ROC assessment tool, please go to our website www.simplemeasures.co.uk. Thank you.